It is a great honor today to be interviewing my friend Jason Olitsky, and I know that you're most known and most passionate about dental photography, and I love your website. I want you to talk about your website, and I mean, you're crushing it there. But before we go into that, which is I know where you want to go, I'm going to take you somewhere else first. Jason, you're 39. You've been out since 2001. So
right.
You've been out a decade and a half. And there's 5,000 kids coming out of school this year. And first, I want you to talk to that person. When I go into those schools, Jason, they're saying stuff to me like, "Oh, Howard, you're lucky. You know, you graduated, 27 years ago, and now dentistry's ruined, and it's all chained, and it's all, they just see the sky falling." And so, they don't realize that when I was a freshman year in college in 1980, interest rates were 21%. Inflation was 10%, unemployment was 12%, everybody was losing the family farm. I had 3 friends in high school whose dads were farmers who lost the family farm and went in the barn and blew their head off. So, wow. I mean, we've all seen tough economies, but you've been out a decade and a half. What do you tell these 5,000 kids? And Jason, these are the specifics you're asking me. Are we all going to be working in chains? This economy is so bad. Jason, should I just go like 3 more years and go into one of the 9 specialties? What advice? Pretend that your daughter is graduating from dental school this year. What would you tell your own daughter who is a senior in dental school?
I would tell her you should sell something to dentists, because that's who makes all the money. The people who sell things to dentists, not the dentists themselves.
Is that a joke or serious?
That's a joke.
Oh, okay, okay.
Yeah, honestly, I love dentistry, and I think it really shows when I talk about what I love to do, because there's just so much excitement right now around the dentistry that we provide. I mean, I went through that a little bit of that depression with you, with the economic downfall, and we worked with a group practice for a few years before we opened up our practice to decide the way we wanted to do things, and when we opened, we actually did really well. We had, our first month was one of our best months on record. And then
you keep saying we. You're talking about you and your wife?
I'm talking about my wife and I, yeah.
Yeah. So to the listeners out there, his wife is a dentist. If you think Jason is handsome, you should see his wife. She is a model. She has to be.
Right. Yeah, right. She's beautiful. Thank you. So when my wife and I opened up our practice, we had a really good year. And we thought that we were going to continue with that trend, into the second year. We were only doing cosmetic dentistry. We were doing smile designs and full mouth rehabilitations, and that's what we wanted to do. And we found that the second year we didn't grow. And then the third year we actually started to do a little bit worse than we had done the previous couple of years. And we realized that we were going to have to change the way we treated the types of dentistry that we did.
So the macro economy started compressing your practice.
Right.
So tell the viewers, what city was that in and what year was that in? You're in Florida somewhere.
We're in Florida, right? We're in Northeast Florida. We live in Jacksonville Beach, Florida. We practice in Ponte Vedra Beach, which is just south of Jacksonville Beach. So it's a nice area. Which
is really the South.
It's the South.
It's a lot more to do like Georgia than it does. Miami's like Central and South America. But where you're at, that's the South.
It is the South, yeah.
What year did it plateau and then start to contract?
Like in 2004, 2005, we were really, that was really like our first year here. And it was such a good year, man. I mean, 3 days a week, we were working 3 days a week. We were doing smiles. We were even turning away patients for cleanings. We were saying, you can go somewhere else for your cleaning. We'll take care of the cosmetic dentistry. I mean, it's incredible. And then all of a sudden, it started to decline. And we were saying to ourselves, why did we do this to ourselves? Why didn't we start with a big general dentistry practice from the get-go when the economy was better, instead of trying to build a general dentistry practice when the economy was bad?
So is that the lessons learned? Is that what you're telling these people? Don't over-specialize in cosmetic dentistry. So tell us then, what was your lesson learned from being too focused on cosmetic dentistry? And then to our viewers, when the economy comes down, in economics it's called inferior goods. So if you're spending lunch for $10 at Applebee's or something like that, those guys suffer because everybody shifts to inferior goods and goes to Taco Bell for $1. So when you're investing in a recession, you want to pull your money out of mid-level restaurants like the Olive Garden and put your money in Taco Bell and Burger King and the Whopper. So when the economy contracts, it's easy to give up on eating out $10 lunch at Applebee's and getting your teeth bleaching and getting a boob job and veneers and a tummy tuck. In fact, I've still put off my hair transplants. I still
it's your look.
Yeah, I still don't have the money to get back into it. So your lesson learned was that you were too over diversified in something that's a luxury item. Right. So when the economy goes down, and to the young kids, I'm going to tell you, the economy's going to go up and down until the end of time. It's never going to be smooth because humans are irrational, make irrational decisions. That's never going to change. So we're always going to have boom, bust, boom, bust, boom, bust. Right. And you, during the boom, you were crushing it in cosmetic dentistry. And then during the bust, what was your lessons learned? Going back, what would you have done?
Lessons learned during... What we would have done would be to build that general dentistry base, because as dentists, we're fortunate that, people need us too. They don't just want us. I mean, I love to focus on the want-based dentistry, but there's validity to the fact that we do general dentistry and people need us for things, and they'll come to us a couple times a year, and that patient base is really what'll grow your cosmetic dentistry practice more than needing to keep generating more marketing, coming up with more marketing materials and things like that. I mean, it's nice to have a general dentistry base to pull from cosmetic dentistry, and they really are some of the better patients to have for cosmetic dentistry, because when you over focus or over specialize in the field, you really are pulling in the most particular patient that you could find out there. So
that was one of my first questions I wanted to ask you, Jason. I don't want to. I almost feel embarrassed to ask you this question because I don't want to sound rude or anything. But when I see just guys like you going after this cosmetic dentistry, me personally, that's the last patient I'd want. I mean, some beautiful woman who has all this critique and all that. I mean, and I know we're all different. Like my most fun, if I could just have specialized in one dentistry, I want the emergency room. I like the guy coming in with a toothache, swollen, needs a root canal extra. I just want to work in an emergency room. And when they have girls come into my office for 27 years and they have a whole list and pictures and all that stuff, I just look at them like, oh my God. And then I send them to this guy up the street who has his fellowship in the Academy of Cosmetic Dentistry, and he loves this stuff. And every time I see him, I tell him, I say, I'm so sorry I referred you to that lady. She was a freak. And he's like, oh no, I loved her. It was great. So what do you think? What do you think makes you like a high needs cosmetic woman who's just like, wow, that's kind of a crazy thing. You're asking for trouble.
I'm a pleaser.
You're a pleaser?
Oh, you really have to love smile design and cosmetic dentistry to focus your practice on it. I mean, you really have to love it, because you do find times where you're with a particular patient, and sometimes it's tough to get that even ground, and you just have to be more particular than your patients. You have to really understand.
We'll take a little time to explain that more, because I know there's a lot of dental students like I see it on. I just went to this missionary dental trip in Chiapas, and there was this one dentist, this kid was just screaming his head off, and he's just all smiling and nurturing and helping him. And I told him, I said, dude, trust me, you should go into pediatric dentistry. No normal person would be smiling right now. I'm cringing and I'm 30 feet away. So I think kids get it with pediatric dentistry. If a screaming, yelling kid doesn't bother you, you should go to pediatric dentistry. Right. What would you tell a kid in senior dental school what attributes or what should be thinking about of maybe wanting to go into high-end elite cosmetic dentistry like you've been doing for a decade and a half?
Well, you have to love being an artist. I think a lot of dentists love being an artist. I think that's one of the great things about our field is that you can be an artist. But also you have to be able to exercise patience, and you have to want to put the time into the profession after hours to understand, that there's so much more to it. The continuing education and, the different types of organizations that are available to us out there. And of course, the photography is so important. And, it's just a love. You just have to really love smiles and just have a general pleasure in making people happy to do cosmetic dentistry.
So let's go into photography. When did you first get interested in photography, and why? I mean, why? How did this passion start with you? Because if I think of dental photography, dude, I only think of you.
I appreciate that. There's a growing field of dental photography. It's a really cool thing. I mean, when I went to dental school, one of your colleagues there had told me that they listened to my webinar, and he's a dental student. And I was like, wow, that's pretty awesome. He said it was a career changer for him. And I was like, does that mean you don't want to be a dentist anymore? You know, what does that mean? But I didn't think he meant it that way. It's something I never thought about in dental school. And when I got out of school, I wanted to be able to match a single central incisor with the laboratory. And I got a point and shoot camera, and I took pictures with that. I thought that was good enough. Digital. I haven't had a film camera. I had a digital camera. Wow. Yeah, it was a G5, a Canon G5. It was a point and shoot.
So so that's the difference between you being 39 and me being 52.
That's
I
right.
had to do a decade of film first.
Yeah, you had an SLR camera that was not digital.
Yeah.
Yeah, I couldn't imagine having to go through that. I hear the stories about using film, especially going through the accreditation process with the Academy. I mean, trying to use film to take pictures would be incredible. But it's changed so much. You know, I wouldn't call myself a photographer. You know, if something happened, I couldn't practice dentistry anymore. It's not like I would take pictures of people's families and babies and make a living out of that. I would never want to quit my day job. I love what it does for dentistry. I love the fact that it affords me to be able to do more of what I love to do, and that's the cosmetic dentistry.
So you mean it allows you to do it because it's better in presenting case presentation? Yeah,
everything. I
mean,
the people that you see, like on the wall behind me, you know, these are people who have had smile transformations in my office, and all these people had something in common before they were on my walls, that they were uncomfortable smiling in front of the camera, and this picture really represents the first time they were comfortable smiling, and that's a big thing because our culture has like this stigma about bad teeth. It's like if you have bad teeth, like you're a bad person, you know, like you don't take good care of yourself, or you're unhealthy, or you have no money, you're just like an unattractive person, and if you have bad teeth and those things don't represent you, then it's nice to be able to do something about it, and being able to take their picture and put it on their walls. It's a celebration of that, and it's really just like, it's just the cherry on top of what I really love to do. You know, it's the cherry on top of the cosmetic dentistry. You know, but I think as dentists, a lot of us, I mean, especially me, I'm the sixth dentist in my family. We all went to Temple.
No way.
Yeah. Oh yeah.
Are you serious?
Yeah.
Now
I
didn't know if you were going to say anything that I didn't already know about you. Go through that. Who's the sixth dentist?
My grandfather.
No way.
My grandfather was a Temple grad, and then my father and my uncle, and then my uncle and my cousin, and then my brother also.
Oh my God.
Yeah.
So you're third generation Temple dentist.
Third generation.
Wow. So how many children did you have?
We have two kids.
Two kids, and what are their ages? Any dentists there?
3 and 6. We'll see. I don't know. I think we might have one that's going to sell supplies to dentists. Just kidding.
Oh, that's amazing.
Does
the fourth generation get automatic acceptance to Temple? I mean, will they even have to fill out an application?
I did, so I'm sure they will. Well, I don't know. I might have destroyed that for them. We'll see. It's you know. So
you're saying that photography allows you to do more cosmetic dentistry because you use it in the treatment plan presentation.
Treatment plan, the communication. I mean, I've never had bad teeth, so I don't know what it's like, you know, for a lot of our patients. I think a lot of dentists don't really know what it's like to have that embarrassment about their teeth. And I want you to think of a time you went out on a date and you were sitting across the table from somebody who you really liked. And you guys are like hitting it off and you're talking and you're laughing. And when you take a bite of some food, you get something stuck between your two front teeth. And all of a sudden, you're a changed person, right? I mean, when somebody says something funny, you look away. I mean, you cover your mouth. You don't engage in conversation with them. And essentially, you're a different person until maybe you get up from the table, you rinse it out, and you come back to the table, and then you're yourself again. And it's like, you know, those few moments are over. And for the patients that we see in our practice, it's like they've had food stuck between their teeth like their entire lives. And it's just like up to us as dentists to take the food out. And that's really all we're doing. And I think we just kind of overcomplicate things as dentists. And the fact that, you know, we'll spend, you know, hours and hours and hours on the details. But really what the most important part of the process is like our ability to make emotional connections with those patients in the beginning of treatments and in the end of treatments. Because if we're not good at that part, then I really don't think the details even matter. And I think what photography does is it enables us to be able to make emotional connections with our patients to get our treatments even started.
I love the way you just said, I've had a very lucky opportunity in my life to meet most of the great ones, yourself included. And the only one thing they all have in common is what you just said, that emotional connection. Like in my backyard, like Omar Reed, he's probably sold more bigger cases. When Omar Reed walks in the operatory, the patient lights up and it's just, how are you doing? And how is your kid? And he's just this bigger than life personality.
Right.
And then you're in 10 more dental offices, and the dentist walks in and like, how are you? And then he points to you have an interproximal lesion here, and that's why you have irreversible pulpitis, and you're gonna need endodontic there. And you're just like, wow. You walked in the room and started pointing at an x-ray. And guys like you, and I want the viewers to know that, I mean, I've seen the best of the best in dozens of countries around the world, and they all have the same thing you have, and that is that emotional connection, that charisma. They walk in there, they make the patient, they're people persons, and you're never going to be a great dentist if you're not a great people person. And if you nail the people person, everything else falls in place. And if you screw that up, it's just, there's no catching up.
You're right. It's about developing friendships with the patients. I mean, all of my patients are my friends. You know, I think that's a common story for a lot of dentists who are successful, is that we're not treating teeth, we're treating people. You know, and that we become friendly with our patients just because, you know, and I think it helps to be enthusiastic, and your enthusiasm breeds your credibility, and that people are, you know, more likely to accept treatments with you if you seem enthusiastic about what you do, because you have a true enjoyment for, or love or a passion for what you do.
So tell me specifics. Specifically, how does photography? How tell us how it is in your regimen. How do you specifically do it? How does this enter the treatment plan presentation? Specifics, down and dirty specifics.
Okay, certainly one of the key components of photography is the ability for us to communicate, and we want to be able to communicate with patients. And you know, the days of holding up a hand mirror are hopefully forgotten, because these days we can take digital pictures and show them to patients. I mean, that continuity, where we contact with patients, not to create disconnects, you know, from, you know, say a patient landing on the websites that you mentioned earlier, that somebody would land on our website and see nice pictures or videos that we've created for them, you know, and say, wow, aha, seems like a really different place. I haven't seen something like this before. And encourages them to pick up the phone, and their first contact with the office is a positive one. And when they walk in the door, they see pictures of patients all over the walls that are smiling. You know, and then you're able to communicate them, and, you know, you ask them questions and things to kind of get in contact with that emotional side of the reason why they even came to the dentist in the first place. You don't really rush to the decision process of what we're going to do, right? I mean, you have to ask them the right kind of questions to get them to open up. And then from that point, you know, taking their pictures in a studio and showing them the pictures on computers and showing them similar cases that you've done, like them, and show them the results that you've achieved in your practice and the other happy patients. I mean, the goal of taking pictures isn't to take a million pictures to show people, because people can easily get overwhelmed with too many pictures. The goal is to build your portfolio so that you have that perfect case to show the next patient that walks in the door, somebody who's a little bit worse, maybe a little bit older, that you can show them the results that you've had before. So
you have a studio then to take these pictures in your office?
Yes.
So describe that, or
Okay, yeah, it's something that I've had when I built my practice. I said, you know what, this is going to be something I'm going to want to do a little more. I have 5 treatment rooms, and the guy who helped us build the practice has worked with a lot of dentists. He said, this is not enough treatment rooms. You and your wife are going to need to move out of this place in 5 years. And he bought us a nice dinner at Ruth's Chris, because we've been here much longer than 5 years based on our bet. And what we've done is we kind of decided we're going to work only out of a couple rooms. And we're going to set up one of our treatment rooms as a photography studio. And I got to tell you something, I use it on every single patient. It's a room that has a seamless white backdrop in it. I have background lights in there. I have studio strobes. I have tripods. I have microphones, everything that gives me the ability to take the highest quality photos I can, and even the highest quality videos that I can now with digital SLR cameras. And I use that studio on every patient that comes into practice. We take all the series of pictures in there. I use it continuously through cases. When I see a new patient, we have their before pictures. I take their treatment planning pictures, everything I need for aesthetic visualization, including video. You know, nowadays, I mean, we're doing so much with video, it's almost making photography obsolete. In the future, I'm sure that we're going to get all our information from video, and photography is going to play less of a part in what we do than video does. And utilizing those pictures throughout the provisional stages, throughout cementation stages, being able to show patients what they've got, you know, in their mouth, you know, as an after, before we permanently cement it in, you know, getting that approval, showing them a before and after picture, and when they love it, you can go ahead and put it in. Those days of me rushing cases in are over. You know, those first couple of years where you focus on cosmetic dentistry, you're so worried that the patient's not going to like it, you rush it in. You almost rush it in. You don't want to give them too much of a chance to see something they don't like. But what I've learned over the years is that you really need to slow down at this process of cementation, take pictures, let them really see those teeth. Give them the opportunity to share their concerns with you so that you don't put them in. I've cut off too many restorations to go through that again. So the process of slowing down, aesthetic visualization, showing patients what you can do. I mean, it's all about the communication with the patient.
And for that, our motto is, at dentaltown.com, no dentist practice solo again. What camera are you using? I mean, do you have some specific brand names? I mean,
I'm a Canon user. Just that's what I started with. Yeah.
Is that Canon's
that's
Japanese,
American and Nikon.
What's that?
Nikon's the Japanese. Yeah.
I thought Canon was Japanese.
Yeah. Yeah, I don't think, but I'm not.
Okay, but so you use Canon, but what Canon camera do you?
My first digital SLR camera was a 20D, and I still have that as a backup camera. My newer camera is a 5D Mark II.
That's a Canon.
That's a Canon. That's a Canon. It's like a more professional line Canon camera.
5D Mark II.
A 5D Mark II. They just came out with the 5D. Listen, you're trying to keep up with the camera lines, and as they come out, that's a job in itself. But
and what does something like that ballpark cost?
I think the 5D Mark III is probably in maybe $2,800, but they just came out with the 5D Mark III, which is probably $3,500.
And that does video and
yes.
Okay.
Yeah, pretty much any digital SLR camera you get now is going to have video. I would say for a photographer, for a dentist who's going to be serious about their photography, that you're probably the camera you're going to get is a 70D as a Canon, or a D7100 for a Nikon. They're both a comparable level, Canon or Nikon, and that's a camera you're probably going to keep for at least 5 or 6 years. Right, so that's like a semi-professional model. So that's what I would look
that on a tripod?
Yes, I do. I use it on a tripod for headshots and for video as well.
Mm-hmm.
Yeah, you want to lock it down for video. It keeps it from looking bouncy. It looks more professional.
For video.
For video.
Okay,
absolutely.
Right.
Absolutely, and for headshots too, because when you take a series of headshots on a tripod, it gives it some continuity. So that
I want to say one thing that I've heard for years is a lot of patients that have done some big cases with me, they're extremely impressed when they see that these are your cases. You did these implants, you did these veneers, you did this stuff, and I cannot tell you how many women have told me that getting a very personal part of their body, breast enlargement, breast augmentation, whatever, that they did 3 or 4 consultations and people are opening up a book or a brochure or whatever. And then they walked into somebody's office and they showed them their portfolio. I did this, I did that. And that's the clencher. I mean, if I was going to have someone do my teeth or my boobs or my hair or whatever, I wouldn't go in and see an artist and say, this is what I've done. I don't want to go in there and see your brochure from the American Dental Association. I mean, I turn around and run. And I think all the high-end discriminating clients. So I think photography, a huge part of photography is building your resume, your credibility, of people that just walk in there and say, I mean, I'm looking at you and I'm just looking at all these women and my thoughts are, number one, when you're taking these pictures, are they topless? Because I don't see any clothes on 4 of them. And
only one of them was my wife.
Only one of them was. But no, I just see that. I just think, oh well, this guy obviously knows what the hell he's doing. I mean, it'd be like walking in a Porsche dealership or a Lamborghini dealership and say, okay, this guy knows high end cars. I'm not going to second guess him. But if you were showing me, a pamphlet from the American Dental Association or a book you got at the Greater New York Dental Meeting on before and after cosmetics, I would be leery.
Right.
And the guy in Phoenix who's doing all the breast enlargements, and most all he does are redos. I mean, he doesn't even hardly does any initials. It's all redos. And Lawrence, it's the same thing. You walk in there and it's just his own studio, and he divides them into like 4 cases. You know what I mean? About 4 situations, and he can just rip through 100 classic photograph cases, and that's who's getting all the business. And he's twice the price. So right. I think photography is credibility, trust, respect.
Absolutely. It's like almost like dentists are from bizarro land, I think, sometimes, because when you look at other industries, could you imagine walking into a car dealership and not seeing cars? Would you buy a car if you walked into a car dealership with no cars? Of course you wouldn't, but a dentist is going to spend thousands of dollars on marketing each month, and when the consumer walks through the door, they got nothing to show them. Like that's insane. Is that not insanity to you? To begin the marketing process, you got to begin with a camera, and you have to get good at your camera so you can take actually pictures that are good for presentation, not pictures that make teeth look scary. That's a big part of marketing. I really agree with you. I mean, if you want to do more cosmetic dentistry, you got to really build your portfolio, because patients are starting to realize that there's a difference out there. You know, they're coming to me, they're driving, you know, a few hundred miles away, they're passing a lot of dentists, and they're getting emotionally connected with the pictures that are on the website. They're coming into the practice, they're already ready to accept treatment because they're, you know, where are they doing their browsing and their window shopping? You know, it's not like our patients come into our practice and they say, oh, no, thank you, I'm just browsing. You know, when patients don't do that, you know, they may browse in clothing stores and boutiques and others, but they don't browse in dental offices. They're doing it on our websites, you know, so it's really important to have a great website that shows people what you can do, because if they land on your website and it's outdated and then they go to the before and after pictures and they're the same ones they've seen on other websites and they just don't look good, they're going to bounce and they're going to go to another website until they find the dentist that they like.
Now, our viewers that are watching on video, they can see on one of the pictures that there's a website, smilestylist.com. Tell me about you. You got a couple of websites. You got Smile Stylist, wallsmiles.com, Clinical Mastery. So if I'm a dentist and I want to start doing these cases and I didn't photo document, blah, 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 you can help them out, right? What do you
Absolutely, yeah.
So talk about that.
Okay, I'm one of the directors of aesthetics with the Clinical Mastery series. It's a fantastic group. We got some great directors there. We got John Nosty, you know, he's like a Dentaltown powerhouse. We got, you know, Mike Smith, Leanne Brady are all directors. And, you know, we teach functional dentistry, occlusion, aesthetics, photography. Really, it's like the basis of dentistry that you can build upon to get from good photography, occlusion, and aesthetics to full mouth reconstructions. And it's such a great group. We're just a friendly crew. You know, we like to have fun.
That's with Jen Janicki.
That's with Jen Janicki. That's right.
She's a class act, brainiac, superwoman.
Amazing. I mean, the woman knows CE. You know,
and
she's really just.
She promotes this with the lab.
Gold Dust Dental Lab is one of our sponsors.
Yeah, Gold Dust Dental Lab. Yes.
Yeah, they're one of our sponsors.
Do our viewers wonder what's going on? I'm in Phoenix, and she's next door in Tempe. Is she Tempe or is that Chandler?
They are in Tempe.
Yeah, so Tempe. I've known her for 20 years. She's an unbelievably amazing woman. That's an unbelievable lab. So you great townies, you got a great CE course on Dentaltown. So does Nosty, Leanne Brady. Just that fourth guy hasn't given me a course yet on Dentaltown. So we'll speak ill will of him until he gets a course up. And he's in my backyard too.
Yep, Mike Smith.
Mike Smith. He's right up the street. And he just got the Arizona Award for most outstanding contribution to the profession of dentistry for the state of Arizona for last year, with all the charity he does at deal. So kudos to him.
Another hardworking dentist.
Yeah, he's a hardworking guy, and he bagged the largest elk I've ever seen in Arizona over the Thanksgiving holidays. That was amazing. But back to the Smile Stylist. So I want to do cosmetic dentistry. I haven't been a photographer. If I went to smilestylist.com, what could you do for that guy? What could you do for that dentist?
A dentist who went to smilestylist.com?
Smile Stylist. Don't you sell the before and after pictures for their marketing?
I have a website called wallsmiles.com.
Okay, what's the difference between that and Smile Stylist?
Smile Stylist is my practice website.
Oh, okay. I'm sorry.
That's our practice brand. No, that's cool. Yeah, that's our practice brand. So when you go to smilestylist.com, that's our patient-based practice. So, you know, that's where the patients get all the information about dentistry and before and after.
So Smile Stylist is B2C. And then Wall Smiles is B2B dentist.
That's right.
Okay. So if I'm a dentist and I don't have any of this before and after pictures, what am I going to find on wallsmiles.com?
Wall Smiles has we have pictures to put on the walls. You know, we have a gallery of almost 50 pictures at this point to put on walls, different sizes. They come ready to hang. So they're frameless and they're mounted on a black gator board, which is a nice clean look. And we also have before and after books, you know, and we have before and after books that contain pictures that you can put on your walls too, to kind of create a nice seamless transition from books to walls. So they appear to be more of cases that you've been involved with, to give you more confidence when you're showing people your, the possibilities of cosmetic dentistry.
That's amazing. And then Clinical Mastery is your actual, clinicalmastery.com is actually your lecture series.
That's right.
And yes. that's a full curriculum. And one of those courses is actually photography.
It is, yeah.
And my friend Gigi?
Yes.
Yeah. I just love her to death. And she just loved your course. And she just ranted and raved about how amazing and awesome that course was.
I love that it's a fun course. I love that we don't have to get so bogged down in details in photography. You know, we can have fun. We show a lot of pictures and videos and, you know, we just experiment and be creative. the fun part of photography. Yeah, so we have the day-and-a-half course, and we travel around a bit, so we get to different cities, make it convenient for dentists to bring themselves and their teams to our courses. And I also teach the Aesthetics Live course, which is an over-the-shoulder course for prep and seed of a smile design. So we do photography in that course as well.
Well, I get you. I'm a half hour down. I got a half hour to go. Do you want to tell us the low hanging fruit of those courses? So, or what do you want to talk about in the second half?
Yeah, sure, man. You know what? One of the cool things about photography is how much I think it's changed, and the evolution of photography. Because what I've seen in just a short amount of time, just like in the last decade, is that we've been taking pictures with a ring flash or a twin light in a certain way, and we just get like these medical grade pictures. And flat lighting, it's just really not very good for presentation. And just seeing what other dentists are doing and trying to stay ahead of the curve is one of the most fun aspects of photography that I enjoy. That's just pulling in people like Dan Lazar from Romania, or Farran, like these people that are, changing the lighting situations. We're using extended bracket arms now. We're modifying the light. We're creating more of a dynamic light for teeth. And so when patients or colleagues see it, they say, wow, that looks really cool. That's something I haven't seen before. And then with the integration of video into that as well, I just think that photography is such a quickly evolving field that it's really fun to be a part of that field right now. But I just couldn't imagine doing the dentistry without it. It's the fact that we need to utilize it so much for laboratory communication, and the way we share photos now and videos with the laboratory. I don't know if you ever did you used to like draw pictures of teeth and kind of color map them, and that was kind of thing you'd mail to the laboratory. And I went through the phase where I would put pictures in Photoshop and I would kind of draw on them in Photoshop so I could email it to the laboratory. So I started emailing pictures, and then I started putting them on a DVD or CD, and that was so painful to have to burn them onto a CD and put them in a box and hope that the CD didn't break on the way there. And then we started emailing them to the laboratory, but you couldn't email that many and they'd be out of order. And nowadays what we're doing is we are starting to put them into like keynote presentations or PowerPoint presentations and sharing them on the cloud in places like Dropbox, so that we can have really large files like videos in a presentation format where it starts in one place and it ends in another place, and share those with the laboratory almost instantaneously. It's a really cool transition that we're going through in dentistry right now.
Now, are you also sending your impression in that way? Or are you putting the impression in a box? I mean,
I'm somebody who still puts my impressions in a box.
So you're complaining about putting your CD in a box.
That's right.
And you're emailing that, but you're not emailing. So you're not following your own word. I've just done my like third or fourth case of emailing in the impression, scanning, and man, that is really, really cool. I just and you know what the labs are telling me? That when you send in an impression in a box, they average 6% remakes, and when you digitally scan it and send it in, they're averaging 1% remakes. They said it is that much more accurate, and they're also saying what you were talking about. The still picture you're talking about, the still before and after. It's the video scanning. So when instead of taking a picture of a prep, they're video scanning it. So they're getting like thousands and thousands of pictures all put together, and they just said that impression is so much more accurate. But you're not doing that. So I'm challenging you. That the next time we do a podcast, you're emailing your photos and your impression.
It sounds good. By that time, my daughter's going to be working for the dental supply company, so you got
it. Okay, so then go through more low-hanging fruit of these courses that you give.
Okay, yeah, you got it. So what we talk about is basic settings. I think one of the things that we have to get over the fact that it's not such a scary machine or piece of equipment, a camera. So we do talk about how to use a camera, just like basic settings and like natural lighting photography, so that you could take your camera out of the box and take it off of that green box setting, that automatic setting of your digital SLR camera, and be able to actually shoot in some of the creative modes and use natural lighting. And we show you how to set a camera and where the different buttons are, so that you can, you won't be so afraid of a camera. I think that, when you pick up a dental camera and you're not used to holding that kind of camera, the first thing you do is try and look through the viewfinder. When that doesn't work, you're just afraid you're going to mess up something when you take the picture. So we get people comfortable with utilizing a camera so you can take pictures of like a party, or, your kids playing sports, or, family events, things like that. And then we put a flash on it. And I give people like the simple settings for dental photography. We show you the complexities of the camera that make it simple. just giving you the settings, and then we practice those settings in hands-on portions of the day. So we'll go to a clinic, we'll take pictures on each other. We'll get really good at standardized views. In dentistry, it's hard to compare apples to apples when you take pictures of teeth and they're not at standardized views. When I was teaching live patient courses, I'd get dentists sending in pictures of cases that they'd want to bring to the courses, and the pictures would be like, of canted smiles and weird angles. And it's actually impossible to be able to determine whether or not that's a smile that needs improvement or what you would do to the smile. So the ability to be able to take a standardized view is the only way you can really evaluate the dentistry to determine whether or not what needs to be done. So we go over standardized views, and then we go into specialty lighting, and other techniques for getting really cool views. We do video things. We talk about marketing, and we talk about portrait photography. We have a whole half day on portrait photography where we talk about studio equipment. But a lot of practices don't have studios, so we do some speed light courses too on that day where we talk about how to get great lighting in like a hallway, where people don't have a studio.
Jason, how come whenever I go to a studio to get my picture taken, they always turn out the lights? It's always just black. You can never see me. Hey, I want to ask you,
listen,
Dennis.
I got to tell you something. That's something that only happens to you, so you might want to ask them.
Hey, I want to ask you, Dennis. A lot of times slip into the fear mode. I bet the two big fear things they're thinking about listening to you is, number one, do you have to sign some kind of legal release to let that lady, like that beautiful lady to the right there, big hair, big teeth, gorgeous. Does she sign something so that you can put that on your website or whatever?
Yes. Yeah. We have a great photo release. Yeah, that we have every patient sign, and not everybody wants to sign it.
Is that proprietary, or did you?
No.
No. Is that on your website?
I don't have it on my website.
I don't have it on my website. Okay.
No, but I encourage you to share my email. I don't mind sharing my photo release with people if they want to email me.
Because we can put that in the podcast footnotes. We put a transcript at the end of the deal. If you want to submit that, we can publish that.
Yeah, absolutely. I have no problem sharing.
And what percent of the people don't want to sign that?
Very small percentage. A very small percentage don't sign it. We use these pictures. We got to share them with laboratories too. A lot of patients will say it's okay to share with the laboratories or colleagues, but it's not okay to put on Facebook. They'll put a little note on the model release that says teeth only, or only show my picture in your office. Don't show my pictures on a billboard. And we have to respect that. And if I'm going to make a post on Facebook that includes somebody's face, I always get a secondary permission. Even though they've already signed something that says I can do anything with your picture, including sell it, I still get permission from them again saying, hey, this is awesome. I want to put this on Facebook. How does that sound? I want to tag you on it. They say, okay, that's great, or no. Because even though they signed a model release, I still don't want them to be upset with something I did, because ultimately, their happiness is the most important thing. It's not worth ticking off a patient, to be able to put a picture on Facebook. So I always get secondary permission if I'm putting it somewhere like a social media format where a lot of people are going to see it.
Jason, let me ask you a question. I can't think of anybody smarter and more well-versed to ask than this. I mean, really, you're a legend in photography and cosmetic dentistry. But what I don't understand, maybe it's because I'm a guy, but I have 7 inlays, onlays, and crowns on my mouth. I have 7 restorations on my mouth, and they're all gold. Because I don't care what anybody says, nothing fits and lasts longer than gold. I know all the cosmetic people, they don't do any gold. But what I don't understand about all these people in the background, they're almost all women. And I see women decorate their body with gold everywhere. They have gold earrings, gold pins, gold bars to their tongues, in their navel, around their ankle. I mean, they love gold. Right. And then when I say, man, the most rockin' hot restoration in the world would be gold, in Phoenix, the American Indians will do it, the Mexicans will do it, the African Americans will do it, and not one white girl in 27 years has done it. I'm just telling you that it just is what it is. So why, Jason, why do white women decorate their whole body head to toe with gold, but not their teeth? And why do all the other women who are non-white, Hispanic, Asian, African American, love gold everywhere else like I do? I mean, I love gold.
I think any guy would take offense to you asking them how women think, probably except for me. So I'm gonna take that question. As that's okay. I'm gonna answer that question.
That probably is pretty dumb. 2 men having a conversation about how women think. That's pretty.
I think it goes back to aging gracefully. Aging gracefully. They don't want to show signs of wear, right? They don't want to show signs that they've had a problem. So
you think a gold earring is highlighting I got a pretty air, but a gold tooth is like, oh, this tooth is something was wrong with it?
This was a rotten tooth that I got fixed. You know, what
So
we're
it's
doing
highlighting
is
a flaw?
it's highlighting a flaw, and as
But that
opposed to
doesn't make sense to me.
re-virginizing the tooth. I mean, what woman doesn't want something re-virginized? You know, so we're re-virginizing a tooth. That's better than highlighting a flaw, I think, in the perspective from a woman, the way she
And
thinks.
why just white women, but not Latin America,
now you're really.
Asia? I mean, really, Jason.
I haven't seen that same diversity that you've had, you know, as far as variations of what they want in their mouth. Most of the people that I see in my practice want white. All the patients that I have, I think it's just the clientele that I bring into my practice that they would, you know, that they wouldn't want anything but white, you know. So we got to be very, very good at utilizing.
Well, Arizona is about 25% of the land is Indian reservation. We're right next to Mexico, so we're about, you know. So I have 4 groups of people, and it's just the white woman group won't touch gold. If I say to any grandpa man, if I put this in gold, this gold crown, you'll take it to heaven. If I put it in white, you know, it's your deal. They go, oh, whatever lasts longer. Everybody says whatever you think, boss. You're the doc, but it's white women only, won't do gold.
Oh man, the other theory, it's a little bit more technique sensitive, but I think the value is worth it. I love to do it, you know. You're getting good at it.
I want to talk. I don't know if you mind if I switch from photography, but a lot of dentists are wondering, technically speaking, you got all these beautiful veneers. Are these all Empress? And what do you see? Are these all Ivoclar cases or?
They are Empress. These are Empress cases.
Are all your veneers Empress?
They are. Within the last few years, I've been placing more Emax cases. I did maybe like a dozen Emax cases. I was happier with the aesthetic results at that time with Empress. At this point, I'm starting to kind of mix my Emax back into my portfolio. You know, I'm starting to dabble with it again, but I've always been happier with the Empress look for the anterior teeth. When we transition back to the posterior, I'll switch to Emax. And when we get back to the premolars, you know, most of the time those premolars are monolithic anyway, and I'll use an Emax restoration. In the Empress, we're cutting back and layering, you know, similar to Emax, but you know, when we cut it back and layer it, we lose some strength. And in the anterior, I'm more confident with the Empress cases that I placed as far as aesthetics.
And for a senior in dental school who really can't tell you the difference between an Empress and an Emax, can you just be a little more specific? What is the difference between an Empress and an Emax?
I can share with you the lithium disilicates and the pressed lucite reinforced restorations they're different in strength. Primarily, the glass makeup makes them a little bit stronger, and actually quite a bit stronger. But the optical qualities are a little bit different. The way I've seen my cases that I haven't liked as much with Emax has always been with the brighter cases with teeth that are starting out a little bit darker. So the canvas colors of the teeth are a little bit darker, like when we look at shades like ND5 or ND7 types cases. And so when we use a brighter Emax veneer on top of those cases, when we start cutting back and layering in some of the effects in the incisal translucency, I saw a lot of graying at the incisal edges especially that looked like an obvious translucency. So when I look at that, I wasn't as happy with that kind of result as I was with the Empress, which I thought we could make it look more natural, more subtle.
And what are you bonding these on? What is your adhesive dentistry regimen to put on a veneer?
I use a Verilink veneer cement.
Verilink veneer?
Verilink veneer cement, yep. I utilize the tack and wave technique with rubber dam isolation, similar to a good thread that Nasty has on Dentaltown about the tack and wave technique. We do those cementation techniques the same.
What is the name of that thread? Is it called the tack and wave technique?
It's got tack and wave in it, but I'm not sure that's the exact name of the thread.
Tack and wave. I'll try it out.
It's a tack and wave. Yep.
Yeah, I remember that. Okay.
Yep.
And then I got to ask you another thing about cosmetics. Any plastic surgeon doing breast augmentation will tell you their number one complaint is they would have gone bigger. With your cases, I remember when I got out of school in 87, like the whitest shade was B1. I mean, obviously, they've just, in the last 27 years, it seems like B1 has just gotten whiter and whiter and whiter. Is that still a complaint? And what shade are you going? Because some of these women have, some women are walking around town with, boobs that defy gravity, and they're pointing up, and teeth that you can see a block away. So, can you talk about the evolution of the whitest shade?
Yeah,
and
absolutely.
What percent of your cases are the whitest shade, and what is that technically now?
I steer away from that whiter shade, looking at a Chromoscope shade guide, which is the Ivoclar's shade guide. The 010 is that brightest shade. We kind of
010.
010, yeah.
They didn't have that in the 80s.
They didn't have that 010. No, that B1 was white. Yeah, it is not at all white today. If I delivered a B1 case to any of my clients, forget about it. Some of the older population, especially the gentlemen, they can get away with that B1, which in the Chromoscope shade guide would probably be like a 110 to an 040 shade. But when you start getting into the female part of the population, especially younger females, even the older females, they're looking at the B1 colors in their mouth and they're saying that's not bright enough. And so how do you get to that point with a patient? You got to make sure that your provisionals are very close to the color of the final restorations. So if you're going to do, if you're planning a brighter restoration, make sure you have a brighter provisional in, we use Luxitemp, primarily for our temporization technique. And they have a BL shade, which is very close to like an 020, 030 on the Chromoscope shade guide. So when you put that on a patient's teeth, and there isn't a lot of show through from the natural dentition, you know what color that is. And so when the patient says, I love it, you know what to ask for. If they say that's a little bit too dark, you know that you need to bump it up a little bit from there. We don't have shade conversations before they have provisionals in their mouth. I just get a general idea that they say, I really want my teeth to look white, but I don't want people to know that I had veneers. I just want it to look like I whitened really well. That's what everybody says, So we kind of get that color in there. But if you put a B1 in their mouth, they're like, whoa, this isn't really as bright as I was thinking. It's
okay, Jason, we have viewers in every country and every age range. Okay, you're dropping the word Chromoscope. I think a lot of people are probably going to be wondering, what is he talking about? So will you explain that versus a more another shade guide?
Yeah, like the Vita,
more traditional. Yeah,
like the Vita Classic, which is their classic Vita, and they have the 3D Master now, where it's more value oriented. The Chromoscope shade guide was put together by Ivoclar, and it represents the Empress EMAX shade. So when we're pulling cases for patients, I typically use the Chromoscope shade guide from Ivoclar when I'm talking shade with the laboratory, primarily with smile design cases. That's my go-to shade guide.
And that starts that starts with 010 and goes to 020, 030, all the way to what?
04, 110. I don't even know what's at the bottom of that shade guide.
So would 010 be in 2014 would 010 be the whitest shade?
It would be the whitest shade. That would just be a really opaque white shade. And I steer away from that shade. One thing you might want to do is take that shade tab off of the shade guide and kind of move everything up to the top. You move that 010 out, take the 020, put that at the top, and kind of bump everything over once so that patients, if you're going to show it to them, they'll say, oh, I want that one.
So give us your 80-20. So for your average standard beautiful woman getting upper 10 veneers, what shade would be 80% of your shades? Or would it be
Piece of cake. 020. 030. It would be an 020 with the brightest portions, like the incisal 2/3, and it would gradually go down to an 030. That would be my go-to color, depending on the complexion and the hair. Everybody shows their colors a little bit differently as far as the teeth are concerned. So that depends. As somebody gets a little bit older, they want something that's a little bit more age appropriate. It's going to be more of the 030. We're going to throw in more of the 040 towards the gum line. A younger gentleman, I may start him there. I probably wouldn't use as much of the 020, and as the gentleman gets older, then I would use more of the 040s, maybe bring in some 110 in the canine areas. You can kind of see how I'm gradually, utilizing that scale, the Chromoscope.
I want you to spend a little time. I only got you for 12 more minutes. I'm running out of time with you, but when you were trying to sell something, obviously, if some guy just got out of jail yesterday and doesn't have a job, you wouldn't be pitching him a Lamborghini. What do you think this dentist should be looking for? What is an average customer? I mean, is it all women? Is it the 80-20? Is it mostly like women 40 to 50? Is it mostly like women who just went through trauma like a divorce and are trying to fix themselves up? Is it someone who just, is there any red flags of what a dentist might be popping his ears up saying, hey, this lady might be a candidate for taking the time to picture tooth whitening, cosmetic dentistry, veneers. Did you see any common threads among your clientele that you could be looking for, or are they just all over the board randomly?
Yeah, I think that it's true. The reality is you don't really know, and that the best way to get there is by asking the right questions, and getting in touch with any concerns they had about their teeth. we do see a lot of consult for people, regarding their smiles because of our focus. And when somebody comes in the door, you've got to get them back to the situation or the feeling they had that brought them in to begin with. If somebody comes in and you start talking about porcelain veneers or whitening and what it can do for them, you're missing the boat, because somebody had a strong feeling one way or another that brought them into your office. And so you want them to get in touch with that feeling again. And you can ask them questions like when did you first notice this, or what were you doing? Because then they'll start thinking back in their heads as far as what they were doing. Maybe they were looking in the mirror and they saw that their teeth were looking brown, or they saw the spaces, or they took a picture with friends and their teeth looked horrible compared to their friends. And the next question is, how did it affect you? Or what did you do to compensate for that? Because it's not a good thing. People don't like to see themselves that way. And the way they normally compensate for it, or normally it affects them, is that they don't smile as much. People don't like to admit that they don't smile as much, because when you're sitting across from somebody and they seem like a really good person, and you guys are having a good time, you ask somebody, are you somebody who normally smiles a lot? Are you a friendly, happy person? And the answer is yes. So, I think that, people don't like to hear that they're not smiling because of this, and that they're actually not being themselves because of their teeth, and to know that you can help them, with that by improving their smile and how that would affect them and change their lives. Those are the conversations that I have.
Okay, Jason, I think a big fear that the 80% of dentists would have about doing what you do is that they delivered this 10 veneer case to this high needs woman with, and when she's all done, she's going to say, no, I do not like these, and you did a bad job, and they're just going to, talk about that. What percent of the cases is I don't want to slander them and say that they're irrational, they're crazy or whatever, but right. your thought of what this facelift was going to do to you, or your boob job, or your veneers, or your tummy tuck. I mean, you probably thought you were going to walk out of there and look like an 18-year-old Russian runway model. And then you're looking at, what do you do with that? Is it fair to say those are irrational expectations, or how do you deal with those type of expectations? And what do you do when that goes south? And what percent of the time does that go south?
Yeah, you safeguard yourself. You don't know if that patient is going to be a particular or picky patient from the get-go. I create a classification of patients because I feel like I've seen every kind of patient in my practice, and it's like a Piper scale. It's like a 1, 2, 3, a 3B, and a 4. And the reality of it is you don't know where they're going to fall on the classification scale. It's usually a patient that's been in your practice a long time already trusts you. So they're willing to say, you're the artist, you do what you think is going to look great. And then there's patients who may be a little picky about, the color, or one or two things. And then there's a patient who's just picky about everything, but they have realistic expectations. And then you have patients who are picky, but they have unrealistic expectations. And those are the patients you really want to safeguard yourself against. Those are your red flags. They say things like, I just want them to be tighter. I just want them to be in more. You can't really get at what they're looking for. And then you have the patients who start out easy, who say you're the artist and everything's going to be great. And then in the end, they become like one of your most picky patients. And so because I've seen those types of patients quite a bit, those are the patients who can really catch you in the end. And you realize that you can't treat, the patient you think is going to be easy like an easy patient, and just treat the picky patient like they're going to be picky. And so the way to really safeguard yourself against that is to go over compromises and go over expectations from the beginning. And the way I do that is with pictures. I take a series of pictures and I sit down with them. I use digital smile design. I'm a accredited master of digital smile designer. That's with the techniques through Christian Coachman that he's been talking about. And we go over these cases with them. I show them the pictures. I show them where the compromises are going to be. And they understand that before they start. And I think that's really important, because if we get to the end and we're looking at compromises and the patient points something out to you, like say the gingival margin of a lateral is a little shorter than the one on the other side, when you explain to them that that's the way it had to be at the end, you sound like you're backpedaling. But if you talk to them about it in the beginning with your pictures, then they understand that from the get-go. We talked about that.
Okay, be more specific. You said some websites. What's exactly the www dot?
Just now?
Yeah.
Okay.
What was that website you just mentioned 1 minute ago?
I didn't mention a website, but I did talk about digital smile design.
Yeah, explain that. Is that www.digitalsmiledesign.com? And
I believe it is digitalsmiledesign.com.
And what is that?
DSD. I'm not sure what the actual website is, and that's a technique.
That in the notes that you send me?
Yeah, sure.
Okay.
Yeah, I'll sure. It's a technique used really for aesthetic visualization with the patient in the laboratory and basically the whole dental team. It's an ability to put pictures, say in like a keynote program, to use templates and use patterns over teeth, and to share proportions and things, and use digital rulers and help the laboratory with mounting the case, via digital face bow, and being able to do a complete workup over pictures, and then show the patient where you're headed and show the laboratory where you're going. And you get so much more information shared that way than you would otherwise. I mean, let's think about principles of smile design, if we will. I mean, so quickly dentists narrow the scope of smile design to teeth because all we have is models and articulators, but most of the principles of smile design are based on labial dental dynamics and facial aesthetics. And the moment you take an impression and send the patient home, that's it. You don't have another ability to evaluate facial aesthetics and labial dental dynamics. So those pictures and videos are extremely important as far as aesthetic visualization goes, especially when you're communicating with the laboratory, yourself, and the patient.
Now, when you're saying keynote, is that you're a keynote person?
Yes.
Is that an Apple term?
That's an Apple equivalent of PowerPoint.
Okay, so
yeah.
So the old guys like me who are on Microsoft, that's the PowerPoint version in Apple.
That's the PowerPoint. You can do it in PowerPoint as well. I'm just an Apple person, but yeah.
Okay.
I see. Yeah, I enjoy the Apple products.
And how would someone? I mean, I'm sure, playing devil's advocate, I'm sure if I just went onto that website, I couldn't figure it out. How would a guy log onto that website and learn how to do all that?
Yeah, by taking courses or taking workshops. We talk about digital smile design in the Aesthetics Live program. It gives you a good introduction to what digital smile design is.
That's your clinical mastery?
And that's clinical mastery. Yeah.
Man, when you came all the way to Phoenix and gave that course, I wish you would have told me. Yeah. I'm going to have to give you my email. It's howard@dentaltown.com. Next time you come to town, next time you come to town or do that, I like to do that. So okay. If someone wants hands-on, they should go to clinicalmastery.com.
Yes.
And then you also got an online course at Dentaltown. When you talk about that, it was a huge success.
Yeah, the photography course. Yeah, that's a clinical photography course. It goes over how to use a camera and standardized views. It's like the basics. It just strips it down just to make it simple for you. It shows you the possibilities of photography in your practice as well. It shows you what things you can do with marketing, and it's exciting. I like to get people excited about what they can do with dentistry and what they can do with cameras, and then I show you how to use a camera. That's what makes it fun.
I want to try to do I'm going to give you a favor here, from one friend to another. We only got 3 minutes left, so you should score some brownie points to your wife. Plug her book. You tell people about your wife and the amazing things she wrote a book. What, 5 years ago?
Yeah, it's been about 5 years now. It's called The Naked Tooth.
Yeah, talk about that.
Yeah, it's great. It's
you guys are really a dynamic duo because you're both outliers. So I mean, you really are. You're both phenomenally accomplished in your own right. But talk about your wife's accomplishments.
My wife is tremendously supportive, for my passion for what I do. And I really couldn't do it without her. She's like my number one teammate. And she's, she went through the whole process of writing a book for the consumer called The Naked Tooth. And what it does is it just breaks it down for patients, the ability it shares with them the procedures of cosmetic dentistry and how to choose a cosmetic dentist. And it leads with how to choose a cosmetic dentist. And inside the book, it gives them tips, as far as choosing cosmetic dentists, but also how to take care of porcelain veneers, how to take care of temporaries. And it's a book that's available in Barnes & Nobles and available on Amazon.
Okay, and this is something you recommend putting in the waiting room?
Absolutely, yeah. This is a great book for a waiting room. It shares possibilities of cosmetic dentistry.
Tell them exactly the name of it and how to get it on Amazon.
It's called The Naked Tooth.
The Naked Tooth.
The Naked Tooth. Yeah, the first shot of the cover was the picture of Colleen kind of half naked, and the publisher pulled it. They said, no, we're not going to do that. You're going to have to put a picture of a smile. That's too bad, man. That was a cool cover. I took that picture.
You know what it makes, when it came out, you know what it made me think of? Before that book came out, The Naked Tooth, my favorite anthropology book of all time was The Naked Ape by Desmond Morris.
Oh, yeah.
And I never have read an anthropology book after that was half as good as the first one I read. Yeah, The Naked Ape. And was
there a picture of a naked ape on the cover?
God, that was back then. It was just
I would have sold you if it was.
It was just a yellow book with a title. So I am out of time. Jason, what if a dentist wants to ask you a question? Do you give out your email address?
Yes. Yeah, my email is jason@smilestylist.com.
And spell Smile Stylist, just
SMILESTYLIST. LIST.com. So it's
hey,
like
Jason, I know you are an amazingly busy man, and it's just an honor that I got an elite guy like you to come on.
Dude,
because
it's an honor to be on the program.
When I think of dental photography, I only think of you. I don't even know who else there'd be to think about. But
Thanks, man.
Thank you so much for an hour of your time, and you got to promise me your group Clinical Mastery is 4 of you. I got dental courses from all of you except the one Phoenix guy. So you gotta put the pressure on him. And next time you're in town, the next 4 guys, I'd love to have dinner with you or something.
Thanks, man. I really appreciate it. It's been an honor and to be a part of this podcast with you on Dentaltown.
Well,
thank you very much.
Thank you for all that you do for dentistry, for Dentaltown, for Clinical Mastery. You're a guy that gives back big time. You've made the dental playground better than when you found it, and thank you for that.
Thanks, man.
All right, buddy. Have a great day.
Talk to you soon. See ya.